This is the Red Tent Pregnancy Course. Red Tent Pregnancy Course on the third trimester. Today there's a couple of discomforts that we're going to go through of the third trimester that have a lot to do with the way the body is growing. So because of the growth of the baby, the fetus, there are many discomforts in the third trimester. One of the reasons it's so uncomfortable is because the belly is growing and the belly is pushing the spine as well as opening the hips up and stretching out the skin around the belly. So usually stretch marks happen during the third trimester. There are some ways that you can prevent this, like drinking enough water and being hydrated, staying hydrated with your skin, with shea butter, things of that nature. There's also the Braxton Hicks contractions that happen during the third trimester. The Braxton Hicks contractions are a way for your body to get you ready for birth. Your body is getting you prepared physically for contracting and working out those muscles that are eventually going to push out the baby. So it's like little test, like, hey, testing, is this working? And it's going to keep giving you those contractions as tests to prepare you to be ready for labor, not just physically, but like mentally. You're going to have to breathe through, you're going to have to find positions that make them comfortable as you go along toward the end of your pregnancy. So Braxton Hicks, and you're getting bigger, so you're gonna get stretch marks. It's something you really have to keep an eye on if you want to keep that at bay. No scratching areas that are feel itchy. Just add more lubricant, drink more water. Also, there is, because you're getting bigger, there's a lack of sleep going on. Just not just because it's like physically uncomfortable, but it's better for you to sleep on your left side than your right side of your body. So when I massage women that are pregnant, I massage them first on their left side, and then at the end, we switch to the right side. And a lot of people are like, why does it matter what side I sleep on when I'm pregnant? Well, when you're bigger and going into the third trimester, there's 50% more blood volume, and that means that your heart has to pump out more blood, and the way our hearts pump out blood is to the right side. So if you're laying on your right side and you're squishing that, eventually you're not going to get enough blood going into your whole body circulating. So you have to, it's better to lay on your left or on your back at a 45-degree angle so that the blood is circulating throughout your body without being stopped. So it's going to go to your right side, go through your arm, go through your hip, go through your leg, down your left leg, back to your arm, back to your heart. So it's better to sleep on your left than on your right so that you can have better circulation while you're sleeping as well. Also, for in this trimester, because there's less room in your body because the baby's getting so much bigger, um, it's pushing up on your stomach and it's making your stomach actually smaller, and you get less amount of space to eat food. So because it's smaller, there's less space, and because there's less space, you have to eat smaller meals in your third trimester. Whereas your first trimester, you might have had food sickness, morning sickness, night sickness. Your second trimester, you were able to eat more, helping the baby grow. In the third trimester, it's not that you lost your appetite, it's like there's literally not enough space in your body to eat more food. So you have to eat more often. So every like 2, 3 hours instead of like every 5, 6 hours. You have to eat more often because there's less space, you eat less amount of food. And your body still needs enough food to make a baby. So just eat more often. I have to bring snacks with me everywhere. It's a good time to practice bringing a bag with you because when the baby comes, you're going to have to carry a diaper bag, a bottle bag, um, a stroller, things like that. And until the baby starts to walk on their own, you really have to get used to bringing all that stuff. And the third trimester, a lot of women also get acid reflux, and that makes it really uncomfortable. So I would suggest to eat foods that settle down your stomach more often than upsetting that acid reflux. I would personally eat apples, yogurt, bananas, things like that that would help me control my acid in my stomach more and just settle me down. As you're getting bigger, because the baby is growing in you, toward the end, half every week, the baby's growing half a pound. So my son was past his 40 weeks, so they um, were telling me like, hey, your baby's gone past due, you might need to get induced. And that's another option. Birth is another way to plan that. If you're going toward the end, you might have to get induced if your doctor pushes you to get induced, because the idea is the bigger the baby, they try to tell you, oh, it's better to induce. But honestly, I feel like it's more convenient for the doctor to induce you because it's on their time and their schedule compared to just waiting it out. Um, they're going to have to just wait to see when your baby comes, and it might not be as convenient for them than just getting induced, which is on their time. So um, that's just another thing about the third trimester. So thank you for listening. These are some of the discomforts and about the third trimester. If I forget anything, I'll make sure to write it down below, and you can go ahead and read that. Thank you for joining me, and I can't wait for you to experience this beautiful time in your life. And if you're a doula, welcome. This is a great time to learn about women and what they're going through in their third trimester and to make it more comfortable for them as our loved ones, our patients, our clients. We want to have a better understanding of the creators of man, mothers. So, thank you for being here and hope you have a great day. Until next time.